guys, Dr. Kristie Ennis. Today I want to share with you how to get rid of your plantar fasciitis, or that heel pain on the inside of that heel. Now, it's all well and good to work that plantar fascia and try to loosen it up, but the key thing is what actually causes that plantar fasciitis is how you get it to remain gone, not come back, and to go away completely. So the actual cause is usually not from the foot, but it's up in the calf and up in the hip, and I'm going to show you why that is. So when we walk, foot's going to hit the ground. We want that foot to roll in a little bit, and then when we go to push off of that foot, we want that foot to be nice and rigid. So you hit the ground, foot rolls a tiny bit, and then you want it rigid to push off. That plantar fascia, when that foot hits the ground, there's something called the windlass mechanism, where it helps to kind of stretch out a little bit, and then it helps elongate a little as you push off those toes. Now, when this calf, or one of these calf muscles gets really tight, what happens is you don't have what we call that dorsiflexion, that lifting up of those toes in that ankle. So that when that foot goes down, my foot needs to bend enough to be able to push off that heel. So when the calf is tight, it doesn't allow that, but it still has to get it from somewhere. So what happens is it comes from this part of the foot. So my foot comes down, instead of rolling in a little, it rolls in a lot, that pronation, so that I can get my leg over my foot, okay? Your plantar fascia is not designed to withstand that force. So it takes the brunt of that poor little thing down there, and then it gets irritated and tight. So loosening up the calf is actually super duper duper important so that plantar fascia works the way it needs to. So step one is to loosen up those muscles. So we're going to use that Derma Edge, keep that calf nice and relaxed. And I have a lot of problems in this area, so you can probably see it be a little bit bumpy there. I'm going to go all the way down in towards the Achilles and even get into the Achilles a little bit there, making sure you get both sides, because it can be tight on either side there or straight through the back. Going in one direction until it's a little bit looser. Now I'm going to have good blood flow going. The muscles themselves are going to work a little better, and then I'm going to do a stretch. So you don't want to do that stretch with the heel hanging down off of the stair. For one reason, you're going to hang on the ligaments a little bit, which is not great on the ankle. For another reason, that doesn't help in a functional way and how that foot is supposed to work. So I'm going to hold up this column here as I go to stretch. If I'm stretching that right foot, I'm going to bring that right foot behind me, try to keep that heel angled inward a little bit. Heel stays down, and then I'm actually going to bring that opposite foot across to get an even better stretch and to really properly stretch out both of those calf muscles. If you have tightness in through the soleus, bring that foot a little bit closer and then add a bent knee that kind of gets deeper and lower down towards the ankle. So release the muscles, stretch the muscles, 30 seconds to a minute. And then if this joint itself is restricted, you're going to grab a band, attach it to something sturdy, place that right around that ankle. You can even do this with a strap or a belt. And then I'm going to actually do what we call mobilizing that ankle. So now I'm causing a force to go through that joint in case it's not just the muscle that's tight as well. So release, stretch, mobilize. 10 to 15 reps or so of that. So that's all with the calf. Lastly, we want to talk about these fabulous butt muscles. So if this muscle, especially these glute medius muscles, aren't kicking in well, what happens is, again, you get that excessive pronation into that foot, right? So these muscles have to work well to pull that foot back out. So one of my favorite exercises to work on this is with band, right above the knees. And I'm going to turn this way. You can hang on if you need to too. But you're going to come out into or down into a squat, and then I'm going to pull those knees apart and work on lifting the arch at the same time. So now I'm working all the way down through the foot muscle as well as these muscles out to the side to help pull that foot and leg outwards. And again, about 10 or 15 or so. And I worked my glutes already this morning, so my legs are a little shaky as I'm doing this video. But there you have it. The two most common reasons that I see that plantar fascia being irritated. Tightness through the calf or in that joint, and then weakness in through some of those hip muscles. So by all means, work that plantar fascia, get that loosened up. But if you really want to prevent it from coming back again in the future, you've got to address those main causes. So thank you for tuning in. Check out my Instagram at Dr. Kristie Ennis. Click that thumbs up button if you liked the video, and stay tuned for more. Thanks.